Dr. Amie Hornaman. Welcome to the Fieldswell Podcast.
Thank you so much for having me. I'm so happy to be here.
It's my pleasure. You're an author, international speaker, founder of the Better Thyroid and Hormone Institute, and host of a top-rated medical podcast. You're known as the Thyroid Fixer. Talk to us about this name and how your mission came to be.
So it started way back in my 20s when I was competing in fitness and figure competitions and I was doing fitness modeling. And I had done this many times. So the diet is very strict: chicken, broccoli, asparagus. You're hitting the gym twice a day. And I had done that many, many times before. So I knew how my body would respond to that particular diet and exercise regimen. And I was working with a coach, all the things, getting ready for this really big show. And the scale literally went up every single week. By the time that I had dropped out of the show, because I had to, that scale was 25 plus pounds higher. It was crazy to see it go up like that because it shouldn't be, right? Biologically speaking, it should not be going up. So I did what we all do. I went to my doctor. And the first doctor, and I say first because this was a series of many, the first doctor told me that I'm normal and everything was fine. And I don't even know what tests he ran back then, honestly. I have a guess now based on what I see in my patient population, but it certainly wasn't the full thyroid panel that we should be getting.
Sure.
So left him, kept going. Doctor number 2, 3, 4, 5, 6, they all misdiagnosed me. And I look back now and I go, thank God I kept going, because realistically, what if I would have stopped at doctor number 4 or 5, who after 4 or 5 medical professionals, and we put these doctors on pedestals.
Yes,
like
we do.
God, right?
Yes.
Wrongly. After that many, it's like I could have very easily said, you know what, it must just be something that I'm doing. I'm not working out enough. I'm not eating, small enough. I need to restrict more and basically just crush my body.
Right.
And, I was about to do that, honestly, because the frustration, the depression that sets in, the self-blame, all of that is real. So it wasn't until the 7th doctor actually diagnosed me with hypothyroidism.
Okay.
And gave me a pill. So, I was so excited.
The magic pill.
Yes. Let's lose weight. I'm going to take this weight off. My hair's back and all the things. And I gave that 5 months and there was no change. So what she gave me was T4, which we can certainly unpack a little bit more on this conversation. She gave me the inactive thyroid hormone. She gave me what the standard of care is in conventional medicine. You test this, and if this, then you give a patient T4, send them on their way, wish them luck.
Okay.
When that T4 was not working, I started doing my own research, and I'm like, wait a minute, there are other thyroid hormones out there. There's T2, there's T3. Why don't we use these other thyroid hormones instead of this inactive thyroid hormone? And she goes, well, I don't do that. That's not standard of care. And I go, well, I'll find somebody who does. So that's what led me to functional medicine. My functional medicine practitioner, who did all the testing, treated me the right way with the right combination of thyroid hormone replacement, actually spent time and looked at what supplements I'm taking, what my lifestyle is, all of those factors that play a role. He saved my life. So at that point of time, I changed careers. And I knew that this is what I was meant to do, because that frustration that I went through in my 20s in a major medical system, by the way, that enlightened me to say, oh my gosh, women everywhere are dealing with this. It doesn't matter the city, the medical system you're in, they're being dismissed, they're being medically gaslit, they're being misdiagnosed.
It's so easy. First of all, thank you for sharing your story. It's a total inspiration how you've used kind of what you've been through to kind of show up and help others based on your learnings, and you've made it your life purpose and mission. So I commend you for that. But it's like what stands out to me is so often we believe the doctors have all the answers, and you knew deeper something more was going on, and you were on this relentless pursuit to figure out what that was.
Exactly. We all have to. We can't just accept what 1 doctor, 2 doctors, 6 doctors say about our situation. When you know internally that something is off, when you know that you're not normal and everything is fine, quote unquote, then you have to listen to that.
Do you think it was, because I always look at, the fitness competitions and striving for our body to be so thin and in shape. Do you think it was at all like the diet and the pressure for that caused the thyroid disorder?
All day. Yeah,
Okay.
absolutely.
Yeah.
I had, as it turns out, as I learned more about thyroid function, I did
Mhm.
have that genetic predisposition for
Okay.
autoimmune. But
Right.
then it's like, what's that trigger going to be? So
Mm.
often we see in pregnancy and then
Mhm.
perimenopause and menopause. So I use the term thyropause
Mhm.
now to basically enlighten women in their 40s or once they turn 40 that this is where we see thyroid issues because of
Mhm.
fluctuating hormones. The other big trigger is stress. And yes,
Mm.
over
Mhm.
exercising and under eating is a
Mhm.
huge stressor on the body. So yes,
Mhm.
I absolutely believe that that contributed.
Mhm. And some 101 for our listeners who aren't super familiar with what their thyroid is and what it does. Can you give us some background there?
Yes. So it is a tiny gland in your neck that runs your entire body. It literally is the master controller of your body because every single cell in your body has a receptor site on it for thyroid hormone.
Mhm.
So it controls your metabolism, your ability to burn fat, your ability to use food as energy, your hair growth, your body temperature regulation, your glucose or blood sugar regulation. We see people that are diagnosed type 2 diabetes when they're on a ketogenic carnivore diet because their thyroid is off. It
Mhm.
controls your blood pressure, your cholesterol, whether or not you poop every day, your gut motility, your detoxification pathways, your skin cell turnover. I mean,
Mhm.
literally controls everything. So
Wow.
I'm often baffled at
Mhm.
why we don't focus on that
Yeah.
at the top. Like, okay, let's go there
Right?
first and check the thyroid before we start doing all these other modalities.
You know what? It was interesting. So I was listening to some of your, your episodes yesterday preparing for this podcast. And I was like, so many of the symptoms, it's like, wait, we should be getting our thyroids checked because these are symptoms that a lot of people experience. Can you go into what some of those symptoms are to be looking for?
Oh yeah, well, very similar to mine. When at the very, very top, weight gain or the inability to lose weight, no
Mm-hmm.
matter what you are doing. And then I see a lot of fatigue, like crushing fatigue, brain fog. I hear
Mm-hmm.
women say, "Oh, I think I have early Alzheimer's. I can't remember. The recall
Mm-hmm.
isn't there. That motivation isn't there. The drive isn't there." Hair loss, hair thinning, or hair breaking is a big one. Loss of the outer corners of your eyebrows, low body temperature where you're cold and everybody else is
Mm-hmm.
totally fine. They're like, "What's wrong with you? Go put on a coat or something."
Yes.
Um, Dry skin, brittle
Oh my
nails,
gosh.
joint pain,
Mm-hmm.
constipation, bloating, water retention,
Mm-hmm.
a lot of symptoms.
A lot of symptoms. Yeah. So easy to misdiagnose, right? Because there are so many different symptoms. Why do you think that your symptoms were dismissed or unable to be found out right away by these doctors when you were seeking an answer?
Well, I think it comes down to the testing that they did. So,
Mm.
standard of care conventional testing looks at basically only two markers, but there's so much
Mhm.
more that we have to look at. So, they'll look at TSH, which is thyroid stimulating hormone, and then they'll look at free T4, which is the inactive thyroid hormone. So, that's what I was given in the magic pill that did nothing. I was
Mhm.
given the inactive thyroid hormone.
Mhm.
The problem with looking at these two markers is
Mhm.
very, very, very often
Mhm.
a person can have a thyroid problem, be low in active thyroid hormones, but their TSH is within normal limits, like where we
Mhm.
want to see it on that standard lab value panel, and you're going to be dismissed.
Mhm.
And I believe without going back and looking at my labs, I've seen
Mhm.
it enough over and over again to know, okay, they were
Mhm.
looking at my TSH, and while it may have been
Mhm.
elevated for our standards in functional
Mhm.
medicine, it still was within those normal limits of that
Mhm.
standard lab value range
Mhm.
on my labs. So
Mhm.
it wasn't turned red. It didn't get a little H next to it
Mhm.
to alert the doctor. So
Mhm.
they don't have time to see whether
Mhm.
or not your results are actually coming back optimal.
Okay.
They can only look at it and go, are you normal? Like, do they scan your labs really quickly? Okay, are there any H's?
Mhm.
Is anything red? Is anything
Yeah.
marked low? No? Okay, well then this person is fine. We just tell them
Right.
they're fine.
Yeah. And so is this looking at like the antibodies we've developed for that TSH that we're testing for?
Well, so TSH is a brain hormone.
Okay.
It's released by the pituitary. So
Okay.
TSH just it goes out into your system and it goes, let's check around and see if this
Mhm.
person has enough active thyroid hormone going on. And
Mm.
if it senses it, then it quiets down. It doesn't yell at the thyroid gland. But it's
Mhm.
not an accurate test. It really
Okay.
isn't.
Okay.
And then when we move down to free T4, it's like, well,
Yeah.
okay, thanks for telling me how much inactive thyroid hormone I have in my body. What about the active? So that's where we have to drop down and go, every single time you test your thyroid, you have to get a free T3, which is your active thyroid hormone, and you have to get a reverse T3, which tells us how you're converting that inactive thyroid hormone. So that magic pill I was given, I was not converting that over to T3. It was building up in my body as something called reverse T3, which puts our body in survival mode. It shuts us down. It shuts down fat burning. It shuts down energy. It shuts down all metabolism. So we have to look at the two most important markers you can get, free T3 and reverse T3, to really get that picture as to what's going on with you.
And do these show up on regular blood work that we're doing, like yearly blood work, or are these special things we need to order?
Well, they're not specialty in that they're going to cost, $1,000 a test. They're very, very common tests, but your doctor will not order them unless you ask. And then even after you ask, you might get fed a load of bull that, well, I'm sorry, we don't test that. It doesn't tell us anything. I.e., here's what your doctor is actually saying. So if your doctor says no to testing, or your doctor kind of pushes off your request to order the free T3, the reverse T3, or any test that you want to see that is looking and giving a deeper picture of your body, if they say no, or give you some spiel like, oh, there's no reason to test this, here's my interpretation of that. I'm sorry, Lauren, we don't actually know how to help you. And we won't have a clue what these tests mean if we order them and they come back and we're going to look like a fool. So rather than do that, we're just going to give you a line of bull and we're not going to order them at all. That's the interpretation.
And we say, okay, because we don't know to dig deeper because we haven't listened to Dr. Amie's story and her mission. This is so enlightening. Is there a certain age we should start paying more attention to our thyroid? When do we need to begin taking these extra measures to ensure we're set up for success?
So definitely after a pregnancy. So the big times, like I mentioned earlier, hormonal fluctuations, pregnancy, perimenopause, menopause. Those are the three really big times in a woman's life where her hormones are on a roller coaster. And that is enough to flip on that switch to a thyroid problem. So that's why I always keep using the term thyropause. And my definition of thyropause is when a woman's thyroid gland craps the bed after the age of 40 due to fluctuating hormones. So test your thyroid. If you're starting to get these wonky symptoms after pregnancy, don't dismiss it. Oh, well, I was pregnant. So I'm sorry, if you're carrying around an extra 20 pounds 6 months after pregnancy, that's a problem. If all your hair fell out, you're tired, and wait, things aren't getting worse. My kid's getting older, but I'm not getting any better. It's like I might as well still be pregnant. Okay, time to get your thyroid tested. After the age of 40, time to get your thyroid tested. Listen to those symptoms that are given by your body, like your body waving a red flag, like, hey, pay attention to me, please. And then go get tested.
Right. Don't accept that everything's okay. Understand that there can be a helpful solution out there.
Yes.
Have faith in that. Is it more common for women to experience this than men?
It is. It is. The reason being is because when we look at hypothyroidism, low and slow thyroid function, hypo, low, and slow, 95% of all of hypo, low, and slow cases is actually Hashimoto's, the autoimmune form. So when we're looking at autoimmune in general, men have less autoimmune than women because they have this protective barrier called testosterone. And men just naturally, even men with low T, have higher testosterone than we do, unless of course we're supplementing and actually fixing our testosterone levels. So men have higher T levels, and that provides this armor layer of protection against autoimmune. So we really, when we break down hypothyroidism and Hashimoto's in general, only about 10% are over here in the guys, 90% over here in the women.
Wow. How many individuals or women do you think there are that are undiagnosed?
So I heard a stat, and whenever stats are published out there somewhere, you never really know whether they're true or not. So you kind of have to go, okay, I'll take this with a grain of salt. But this one I think is pretty darn accurate. I think the numbers are deflated. I think we have way more, but it's accurate in that 16 million Americans have hypothyroidism. 8 million are undiagnosed. Now, I think it's way higher on both both ends.
Mm-hmm.
I think we have, something like 50 million have hypothyroidism,
Wow.
25 million are undiagnosed.
Yeah.
But about half are walking around undiagnosed for just the reasons that we talked about, the lack of proper testing and the lack of proper interpretation of those tests.
Okay. Wow. Staggering numbers. And so many of us are maybe walking around, have no idea, and are seeking a solution. Once we find out what's going on, what are the healing protocols?
We can break it down into, you have like the lifestyle and supplementation protocols. And then we move over here to, let's just replace the thyroid hormones that are no longer being properly made, depending on how far down that spectrum you are.
Mm-hmm.
So for me, I am on thyroid hormone replacement. You would have to pry it out of my dead cold hands.
Wow.
Because I will never give it up. It gives
Okay.
me life. It
Yeah. Your
optimizes
energy. Yeah.
quality of life,
Yeah.
regulation of my body composition, where I'm not gaining weight looking sideways at a brownie like I was before. Right? I mean, I love that. I absolutely love that.
I love that for you too.
And
Yeah.
sometimes, and I get this question too from patients, like, can I do this? They'll say naturally. Can I do this naturally? And I go, well, here's the thing. So if your child was diagnosed with type 1 diabetes and the doctor came in and said, I'm sorry, she has type 1 diabetes, it's autoimmune. Her body is no longer producing enough, her pancreas is no longer producing enough insulin, which is a hormone. We need to give her insulin in an insulin pump in order for her to, utilize her food and glucose. You wouldn't go, oh yeah, no, I don't want to take a medication. I know it's a hormone, but I don't want to take a medication. Because then the doctor will go, well, then your child's not going to survive because you need this hormone for life. And that's how we have to think about thyroid hormone. It is a hormone required for life. Yes, you might have to pick it up at a pharmacy, but if it actually gives you quality of life and gives your whole body's, it allows your body's system to work properly. Oh my goodness, who cares? Right? Who cares? Now over here, we can absolutely do the no processed foods, elimination of sugar, really focusing on whole foods, adding in iodine, vitamin D, selenium, magnesium. I love black cumin seed oil. That's why I put in my Hashimoto's Fixxr that lowers inflammation. It takes down antibodies. It can put someone into a state of remission that has Hashimoto's. I love T2 thyroid hormone that's available over the counter that increases your basal metabolic rate and helps with energy. So there's a lot of supplemental and lifestyle things we can do and we can try, but then you might have to step over here, still do all of the lifestyle things, but then let's sprinkle in a little bit of thyroid hormone replacement to get you totally optimized.
Okay. Amazing. Yeah. And it's not like an overnight fix. This sounds like it is a lot of lifestyle changes and just setting yourself up for success for the rest of your lifetime, knowing that you have this condition.
Exactly.
And understanding that stress and changes in hormone are some of the main causes. Is there anything else that, as more of a preventative measure, we can look at, like, okay, here are things I can be doing today to ensure that this maybe doesn't happen later? Or what would you suggest in that realm?
So if we look at the fact that 95% of all hypothyroidism is Hashimoto's, autoimmune. Now let's look at what can we do to keep autoimmune at bay. Well, it's really hard these days because we are exposed to so many toxins and chemicals that really disrupt the body's immune system and trigger autoimmune. So doing things like keeping your detox pathways open. Well, you can't detox unless your thyroid's working well. So that's one thing, but doing things to really eliminate the toxins as much as you possibly can, as much control as you have. It's the 80-20 rule. 80% you can control, 20% you can't. So, looking at what you're putting on your body, what are you putting in your body? Are you buying organic? Are you buying grass fed? Or are you being constantly bombarded and exposed to all of these environmental toxins, chemical toxins, food toxins that can throw your system out of whack and trigger autoimmune to express itself?
Environment's so important.
It is.
And that to understand the skin is our biggest organ. It's wild. Yes.
Oh my gosh. Yeah. Remember the days of Bath and Body Works?
Yes.
Going in there, smelling, putting it on. It's like, we're just putting on endocrine disruptors.
So now there are different apps you can have on your phone. I know I use Yuka, which scan the labels of a lot of my body washes and it'll give me a score.
Yes. I love it. I love it.
Super helpful.
It's so simple for people to use.
So you've created a line of supplements called Fixxr.
Yes.
What makes these formulas different from what we typically see in the market? Tell us more about your product.
Well, a lot of love behind them and my name behind them, so that makes a difference too.
Yes.
But no, I created this line for what I see and what I saw in my practice daily. So the big things of that weight gain, the inability to lose weight, that is so frustrating, especially
It is.
when you're a woman. I'm sorry to leave the dudes
Yes.
out, but women, listen, like when we're 5 pounds heavier, we're like, oh man,
Yes.
I don't want to go out tonight. I don't want to get dressed. Everything is tight. You're pulling on your
Yeah.
clothes, the whole thing. When your hair's falling out, you're so self-conscious. You're like, no, I don't even want to style my hair because it's falling out in clumps and it looks thin and all that. So that's really, I mean, it steals our quality of life. And I wanted to curate a line that, yes, it supports thyroid function 100%, but it can also give people a better life. So Thyroid Fixer and Metabolism Fixer both have T2 in it. And
Okay.
I've been studying T2, which is one of the active thyroid hormones, not in pharmaceutical form. It is available over the counter, thank God. But when you look at the T2 thyroid hormone, it actually increases our basal metabolic rate. It increases the amount of fat that we are burning at rest. It produces nice, steady energy through the day. And it does all of this without being stimulating to the heart. There's no cardiovascular effect where you feel like you're going to have a heart attack after taking a fat burner. And then there's no thyromimetic effect, meaning in taking T2, if you were to take my thyroid fixer, because you just can't lose weight, you're on the struggle bus with metabolism, it's not going to send a signal back to your brain and your thyroid to stop producing its own thyroid hormone. It's not going to affect your labs where your doctor is going to say, what are you doing here?
Yeah.
It's just going to work at the cell level, at the metabolism level to increase that. And then, like I mentioned, we have Hashimoto's Fixer, which lowers
Yeah.
Hashimoto antibodies and inflammation. So that's really how I've curated that whole entire line. What do my people need? What do my patients need?
It almost sounds like these would be good for anyone to take to optimize thyroid function. Do you only suggest taking them if there is hypo, hyper, or Hashimoto's?
No, actually, and the funny thing is of course, Thyroid Fixer was born out of 15 years of research, love, right? So I wanted to name
Yeah.
it after me, the Thyroid Fixer. But then I realized we got all these questions like, can I take Thyroid Fixer if I don't have a thyroid problem? I'm like, oh, yeah, you can.
Yeah.
I'm like, I got to come up with, okay. So then we came up with Metabolism Fixer,
Okay.
which also has T2 in it. And that pretty much sends the message out. It's going to fix your metabolism.
Yeah.
Metabolism Fixer, though, we also added Suppressa because I'm sure you've been hearing this, a lot of food noise talk. People are on the GLPs because they have these
They're on the GLPs. Yeah.
cravings, right?
Yeah.
Food noise,
Yeah.
cravings. So they go to the GLP route. Suppressa is a trademarked ingredient that takes the edge off of those cravings. We've seen a reduction in appetite and cravings at about 67%, but it doesn't smash your appetite. When I was playing around with a higher dose GLP,
Yeah.
I'd be taking bites of this big, beautiful, perfectly done steak and literally go, I can't. Like,
Yeah.
I can't eat another bite. No, it's not going to do that. It's not going to slow gastric motility to where you're going to be constipated. It just takes the edge off that food noise.
And let's talk about microdosing GLP-1s.
Yeah, I do like the microdose.
Yeah.
I'm opposed to the macrodose. I'm opposed to people using it where it crushes their appetite because then you can't get in the protein that your body needs.
Right.
But using it in a microdose form, the research now that we are seeing, combined with the anecdotal research, we're finding that it significantly lowers inflammation in the body. Yes, it's helping to control that A1C and insulin that we know fuels Alzheimer's, fuels cancer, makes us fat, all the things, all metabolic diseases. But it's giving the person better control of that. It's helping improve mood. This is one thing that I've heard from my patients as well, that, oh my gosh, all of a sudden my mood is better. And it's because it is acting on the brain, lowering our risk of Alzheimer's significantly. Joint pain reduction, huge, that we're seeing across the board. People that have had rheumatoid arthritis and pain for years now on a GLP see a significant reduction in that.
And what fraction of, say, a standard dose would you say is a micro?
Everybody's different.
Okay,
You have to
fair.
literally find your
your sweet
microdose.
spot.
It really is. Like, my microdose is a little bit higher than my colleague and friends who's super sensitive to all things. So she's on like a 0.25 milligram dose of tirzepatide, where I'm at a 1.
Fair. Is this something you envision, like individuals taking weekly, like for an indefinite amount of time, or just like once a month, or what does that look like?
We still microdose weekly. Now, a person can space it out and go every 2 weeks as well. but you want to still have that pulse in the system, because if you go once a month, then it's pretty much out of your system and you're done.
Okay.
So pulsing that every so often, I think is key. It's beautiful. And yeah, I mean, for now, until more studies come out to the contrary, I'm going to continue on it, honestly, for the extended period of time for my life.
Yeah. I mean, it's so incredible to see the other benefits, not just the control over appetite and weight loss.
Oh, exactly. And we're even seeing improvement cardiovascular function. We're seeing a little bit of a stimulation of muscle protein synthesis as well. So where people at the macro dose will actually lose lean muscle tissue, we're seeing an improvement in lean muscle tissue at the micro dose, because people are still able to lift and get the protein in and all their nutrients.
As we wrap up, thank you, first of all, for sharing all of your insights, your story. You're so fun to talk to. I really enjoyed our conversation. I'm curious, like, for those who are struggling, go back to like the version of you who was really trying to find like what was going wrong, and they feel like something is going wrong and they're not getting the right answers. Say maybe they're struggling with hormone issues. What's a piece of advice you could share with our audience?
Well, you listen to your body and you don't stop until you find someone that specializes in thyroid and hormones. So that's what we say in our clinic. We prescribe to all 50 states. And anytime I tell people that, I'm like, we specialize in thyroid and hormones. If you want an Epstein-Barr specialist, find an EBV specialist. If you want a person that specializes in just everything gut, you go find a gut specialist. You don't just go find functional medicine and think that because they have the term functional in their title, they're going to know what to do with your thyroid and hormones. You want to find and work with a thyroid hormone specialist, but you listen to your body and you do not stop. You don't give up, because again, going back to the first part of our conversation, if I would have given up, I wouldn't be here with you today.
Right.
So you don't give up.
We wouldn't be having this conversation. Incredible. Where can our listeners find you?
So you can go to dramie.com, DRAMIE.com. That's where you can book a call. If you're interested in working with us, you can find my podcast, the Thyroid Fixer podcast, on there. And then if you want to join our Just Fix Your Thyroid Facebook group, that's what it's called, Just Fix Your Thyroid. And it's a beautiful group where you can, if you have questions, if you're like, I got these labs done, I'm not quite sure if I have a thyroid problem or not, you can post your labs in there. You can post your treatment protocols in there. Any questions, we're all in there supporting. So myself, my team, former patients that have basically as much knowledge as I do at this point, that they're in there supporting you as well.
Fantastic. Amie, Dr. Amie, the Thyroid Fixer, thank you so much for coming on today.
Thanks, Lauren.